how to masturbate safely after 60, and the 3 big mistakes you must avoid. First, let's clear the air. Masturbation is not only normal, it's healthy, and it becomes even more important as you age. Some men in their 60s, 70s, and beyond start to wonder, does my body even need this anymore? Am I harming myself? And unfortunately, shame, silence, or old-fashioned myths can make you feel guilty for something that's actually helping you. Here's the biological truth. Regular, gentle self-stimulation supports circulation to the penis, helps maintain erectile tissue, supports prostate health, lowers stress hormones like cortisol, and even improves sleep by calming your nervous system. Emotionally, it helps men stay connected to themselves, reducing anxiety and preserving a sense of vitality and masculinity. But, and this is the key, your body no longer responds like it did at 25. That's not dysfunction. That's biology. Skin becomes thinner, nerve endings fire more slowly, blood vessels lose elasticity, which means the way you approach pleasure must evolve. Think of it less like fixing a machine and more like caring for a classic car. With the right touch, presence, and attention, your body can still bring you deep relaxation and satisfaction, but only if you avoid the 3 mistakes most men fall into. As I mentioned, I'm Dr. Nerita. I've been a practicing urologist for 12 years, specializing in men's health. I've counseled men from their early 30s to well into their 80s. And what I've seen again and again is this. It's not usually the body that holds men back, it's misunderstanding, rushing, or shame. So let's break it down together. Here are the 3 biggest mistakes older men make when it comes to masturbation, and what to do instead. Mistake number 3, rushing through it. Let's be honest, many men treat self-pleasure as something to get over with quickly, like scratching an itch. But here's what happens in the body when you rush. Your nervous system stays in stress mode. Blood vessels constrict instead of opening. Your heart rate rises, but in an anxious way, not a relaxing one. Emotionally, rushing trains your brain to associate intimacy with tension instead of safety. That reduces satisfaction over time. Practical fix? Slow down. Even 5 extra minutes makes a difference. Turn off distractions, take a few deep breaths, allow your body to arrive before moving into touch. When you stop rushing, something surprising happens. Your sensitivity comes back, even if you thought it was gone forever. Mistake number 2, using too much pressure. This is incredibly common. As sensation decreases with age, many men tighten their grip or move more aggressively to compensate. But the penis isn't built for force. It's made of delicate, spongy tissue and fine nerve endings. Excess pressure leads to micro tears in the skin, nerve desensitization, sometimes called death grip syndrome, difficulty responding to a partner later, inflammation and irritation. Emotionally, this can lead to frustration, needing stronger and stronger stimulation, yet feeling less and less satisfied. Practical fix? Loosen your grip. Use a fragrance-free, water-based lubricant. Think of your hand not as a vice, but as giving a massage to your circulatory system. With time, your body adapts. Sensitivity increases, not decreases, when you give it gentle, steady touch. Mistake number 1, ignoring your emotions. This one surprises most men, but your emotional state is just as important as your physical technique. Many men over 60 carry quiet shame about masturbation. Maybe you were told it was wrong growing up. Maybe you feel unsettled about changes in your body. Here's the biology. Unresolved shame activates your stress response. Cortisol levels rise, blood vessels tighten, and arousal becomes harder to sustain. Emotionally, shame creates distance, not only from yourself, but also from your partner if you have one. Practically, this shows up as difficulty relaxing, difficulty enjoying touch, and sometimes erectile struggles. The fix? Compassion. Remind yourself, you're not broken. You're in a new phase of life, one that asks for more attention and care. If needed, talk to a trusted doctor, therapist, or friend. Intimacy isn't only physical, it's also emotional health. So how do you put this all into practice? Here's your step-by-step. Create a safe space. Privacy, quiet, no distractions. Clean and protect, wash your hands, have a fresh towel, use lubricant. Start slow, focus on breathing and relaxation before touch. Gentle stimulation, loosen grip, vary rhythm, explore sensation. Check in. If you notice pain, irritation, or swelling, pause and evaluate. Release shame. Remind yourself this is healthy, normal, and restorative. Aftercare. Breathe, relax, and allow your body to settle. Done mindfully, this becomes less about finishing quickly and more about supporting your whole body health. Now, maybe you're thinking, I've been doing it wrong for decades. Is it too late? Absolutely not. Most men were never taught how to adapt to these changes. That's not your fault. But here's the good news. Your body is incredibly adaptive. With patience, it will respond. And many men in their 60s and 70s actually rediscover pleasure more fully because they've finally learned to slow down, listen, and be present. You're not past your prime. You're entering a stage of mastery. Gentlemen, here's what I want you to take away. Your body still matters, your pleasure still matters, and your confidence is absolutely worth protecting. Masturbation after 60 isn't about clinging to youth, it's about honoring the man you are now. Stronger, wiser, more intentional. Age is not the end of vitality. In many ways, it's the beginning of true mastery. Small changes, done with care, can restore your comfort, freedom, and dignity as a man.